Excuse me, I need something for my daughter's fever. She's been burning up since last night, and I'm really worried.
I understand your concern. How old is your daughter, and what's her temperature right now?
She's 7 years old, and her temperature was around 102 degrees this morning. Should I be panicking?
That's definitely elevated, but not an immediate emergency. Has she been taking any medication already?
I gave her some children's ibuprofen around 6 this morning, but it doesn't seem to be working anymore.
When you say it's not working, has the fever come back completely, or is it just slightly elevated?
It went down to 99 for a few hours, but now it's climbing back up again. Is that normal?
Yes, that's actually quite normal. Ibuprofen typically lasts 4 to 6 hours. You can alternate it with acetaminophen for better control.
Wait, I can give her both medicines? I thought mixing medications was dangerous. It's safe when done correctly. Give ibuprofen every 6 hours and acetaminophen every 4 hours, but stagger them by 2 hours. That sounds complicated. Can you write that down for me? I don't want to mess this up.
Absolutely. I'll write out a schedule for you. Also, make sure she's drinking plenty of fluids. Is she eating anything?
She had some soup earlier, but she's mostly just wanting to sleep. Should I wake her up to give her medicine?
If her fever is high, yes, wake her gently. But if it's under 100 degrees, let her rest. Sleep is healing.
Okay, that makes sense. And how long should this fever last? When should I actually take her to the doctor?
If the fever persists beyond 3 days, or if it goes above 104 degrees, see a doctor immediately.
Got it. And one more thing, should I be giving her anything else, like vitamin C or something?
Vitamin C won't hurt, but focus on hydration and rest first. Here's your medication and the schedule I've written out.
Thank you so much. You've really calmed me down. I was imagining the worst.
That's what we're here for. Call us anytime if you have more questions. Feel better to your daughter.
Hi, I need to ask about something kind of personal. Is there somewhere more private we could talk?
Of course. Let's step over to the consultation area. What's going on?
Well, this is embarrassing, but I've been having some digestive issues lately. Really bad constipation.
There's nothing to be embarrassed about. This is extremely common. How long has this been going on?
Maybe 5 or 6 days now? I've tried drinking more water, but nothing's happening.
6 days is definitely uncomfortable. Have you made any changes to your diet or routine recently?
Actually, yes. I started a new high-protein diet for the gym. Could that be causing it?
Absolutely. High-protein diets without enough fiber can definitely cause constipation. Are you eating vegetables and whole grains?
Honestly, not really. I've been mostly eating chicken, eggs, and protein shakes. That's the problem, isn't it?
That's a big part of it. Your digestive system needs fiber to function properly. Let me recommend a few things.
Please do. I'm willing to try anything at this point. This is really uncomfortable.
First, I'd suggest a gentle fiber supplement you can mix into your protein shakes. Also, a stool softener for immediate relief.
Wait, what's the difference between a stool softener and a laxative? I've heard laxatives can be harsh.
Good question. Stool softeners work gently by drawing water into your intestines. Laxatives stimulate contractions and can cause cramping.
Okay, so I should start with the softener then. How quickly does it work?
Usually within 12 to 72 hours. In the meantime, add prunes, beans, and leafy greens to your diet immediately.
Prunes? Really? I thought that was just a myth my grandmother believed in.
Not a myth at all. Prunes contain natural compounds that stimulate digestion. They're actually very effective.
All right, I'll grab some on my way home. Should I stop the high-protein diet completely?
No need to stop it. Just balance it with fiber-rich foods. Aim for at least 25 grams of fiber daily.
25 grams. Got it. And if this doesn't work in a few days, should I come back?
If you don't see improvement in 3 days, or if you experience severe pain, definitely see a doctor.
Thank you so much for not making this weird. I was really nervous coming in here.
That's what we're here for. These issues are more common than you think.
Take care.
Young man, I need help understanding these pills my doctor prescribed. The instructions are written so tiny.
I'd be happy to help. Let me see your prescription. Oh, this is for blood pressure medication.
Blood pressure? But I feel fine. Why do I need medicine if nothing hurts?
That's actually why high blood pressure is called the silent killer. You can't feel it, but it's damaging your arteries.
That sounds terrifying. How do they even know I have it if I can't feel anything?
Your doctor measured it with that cuff they put around your arm. Remember that?
Oh, that squeezing thing. Yes, they did that. But are you sure I really need pills? Can't I just eat better?
Diet helps tremendously, but your doctor prescribed this because your numbers are high enough to need medication.
What if I just take half a pill? These medications always have so many side effects.
I understand your concern, but you must take the full dose as prescribed. Taking less won't protect your heart adequately.
My heart? I thought this was for blood pressure. Now you're telling me it's about my heart, too?
They're connected. High blood pressure forces your heart to work harder, which can lead to heart attacks or strokes.
Oh my goodness. When should I take these pills? Morning or night? With food or without?
Take one tablet every morning with breakfast. It's important to take it at the same time each day.
What happens if I forget? Should I take 2 the next day to make up for it?
Never double up. If you miss a dose and remember within a few hours, take it then. Otherwise, skip it and continue normally.
This is so much to remember. What if these pills interact with my vitamins?
Which vitamins are you taking? Some can interact, so it's important to check.
I take vitamin D, calcium, and a multivitamin every morning. Are those okay?
Those should be fine with this medication, but take the calcium at least 2 hours apart from this pill.
2 hours apart? Why is everything so complicated with medicine these days?
Calcium can reduce absorption of some medications. I'll write down a simple schedule for you to follow.
You're such a patient young man. My grandson should be more like you. When do I come back for refills?
This prescription is for 30 days. Come back in about 3 weeks and we'll have it ready for you.
I need the strongest pain reliever you have. My shoulder is killing me after training yesterday.
Let's slow down. Tell me exactly what happened and where the pain is located.
I was doing overhead presses and felt a sharp pain in my rotator cuff. Now I can barely lift my arm.
And you want to take pain medication and keep training. That's not how injuries work.
Look, I have a competition in 2 weeks. I need something strong enough to get me through my workouts.
Absolutely not. Masking pain with medication while continuing to train will cause permanent damage.
But I've been training for months. I can't just stop now. There must be something you can give me.
What you need is rest, ice, and probably physical therapy. Pain is your body's warning system.
Can't I just take some prescription-strength ibuprofen? My training partner does that all the time.
Your training partner is making a mistake. Anti-inflammatories reduce pain, but don't heal injuries. You're risking a complete tear.
A complete tear? Are you trying to scare me? It's just a little soreness.
If it was just soreness, you'd have full range of motion. The fact that you can't lift your arm is serious.
Okay, fine. What should I actually do then? I'm listening now.
Ice it for 20 minutes every few hours, take regular strength ibuprofen for inflammation, and see a sports medicine doctor.
A doctor? That seems excessive. Can't I just rest it for a few days and see how it feels?
You could, but rotator cuff injuries are tricky. Without proper diagnosis, you might be resting the wrong way.
The wrong way? How can there be a wrong way to rest?
Some injuries need complete rest. Others need gentle movement. Only a professional can determine which applies to you.
This is so frustrating. What about those pain relief creams? Do those actually work?
Topical creams can help with surface pain, but they won't address deep tissue damage. I can sell you one, but it's not a solution.
What if I modify my training? Could I work on lower body stuff while this heals?
That's smart thinking. Yes, you can train other areas as long as you're not compensating with the injured shoulder.
Okay, I'll get the cream, some ibuprofen, and book an appointment with a doctor. Happy now?
Very. Trust me, 2 weeks of proper healing is better than 6 months of chronic pain.
You're tough, but you're right. Thanks for not just selling me what I asked for.
That's my job. Take care of that shoulder. Come back and tell me how the competition goes. Hi, I'm traveling to Southeast Asia next month, and I need to build a comprehensive medical kit. Where do I start?
Great that you're planning ahead. How long is your trip and which countries specifically?
6 weeks through Thailand, Vietnam, Cambodia, and maybe Laos. I've never been to that region before.
Exciting trip. First question, have you consulted with a travel medicine clinic about vaccinations and anti-malarials?
Yes, I've got all my shots scheduled, but I'm worried about getting sick over there. Should I bring antibiotics?
You can't buy antibiotics over the counter here without a prescription. Has your travel doctor prescribed any preventatively?
They mentioned getting a prescription for traveler's diarrhea, but I haven't picked it up yet. Is that necessary?
Highly recommended. Traveler's diarrhea affects about half of all tourists to that region. Having treatment ready is smart.
That's alarming. What else should I be worried about? I'm starting to get nervous about this trip.
Don't be nervous, just prepared. Let's build your kit systematically. For digestive issues, you'll need anti-diarrheal medication and rehydration salts.
Rehydration salts? Can't I just drink water if I get dehydrated?
Water alone doesn't replace electrolytes lost through diarrhea. These packets are essential. They can literally be life-saving.
Okay, definitely getting those. What about pain relievers? Should I bring a lot?
Bring both acetaminophen and ibuprofen. Acetaminophen for fever with dengue risk, and ibuprofen for general pain and inflammation.
Wait, why different ones for dengue? That sounds specific.
Dengue is transmitted by mosquitoes in that region. Ibuprofen can increase bleeding risk with dengue, so acetaminophen is safer.
Mosquitoes? I didn't even think about that. Should I bring bug spray from here or buy it there?
Bring DEET-based repellent with at least 30% concentration. You can buy more there, but have some for your arrival.
What about altitude sickness? We're planning to go to some mountainous areas in northern Vietnam.
Good thinking. Altitude sickness medication requires a prescription. Talk to your doctor about getting acetazolamide just in case.
This list is getting long. Should I also pack antihistamines? I have seasonal allergies here.
Absolutely. Bring your regular allergy medication. Also pack antihistamines for potential allergic reactions to unfamiliar foods or insect bites.
What about cuts and scrapes? Should I bring bandages and antibiotic ointment?
Yes, a small first aid kit with various bandages, antibiotic ointment, and antiseptic wipes is essential.
Should I worry about water purification? I've heard the tap water isn't safe.
Correct. Drink only bottled water with sealed caps, and consider packing water purification tablets as backup.
This is so much information. Can you write down a complete list for me?
I'll print you a comprehensive tropical travel checklist. Let me grab everything we've discussed and ring you up.
My baby has been crying non-stop for hours. I think it's colic, but I don't know what to do.
Take a breath. You're doing fine. How old is your baby and how long has this been happening?
She's 5 weeks old. This crying started about 2 hours ago, and nothing is calming her down.
Is she fed, dry diaper, not too hot or cold? Let's rule out the basics first.
Yes, to everything. She ate an hour ago, fresh diaper, room temperature is fine. She just keeps screaming.
Does she pull her legs up to her chest while crying? That's often a sign of gas or colic.
Yes, exactly that. Does that mean it's definitely colic? Can I give her something?
It sounds like it could be. For babies this young, we have simethicone drops that are safe for gas relief.
Simethicone? Is that like the gas medicine adults take? I want to make sure it's safe.
It's specifically formulated for infants. It's one of the safest medications for babies because it isn't absorbed into the bloodstream.
How does it work if it's not absorbed? That doesn't make sense to me.
It works by breaking up gas bubbles in the stomach.
My baby has been crying non-stop for hours. I think it's colic, but I don't know what to do.
Take a breath. You're doing fine. How old is your baby and how long has this been happening?
She's 5 weeks old. This crying started about 2 hours ago, and nothing is calming her down.
Is she fed, dry diaper, not too hot or cold? Let's rule out the basics first.
Yes, to everything. She ate an hour ago, fresh diaper, room temperature is fine. She just keeps screaming.
Does she pull her legs up to her chest while crying? That's often a sign of gas or colic.
Yes, exactly that. Does that mean it's definitely colic? Can I give her something?
It sounds like it could be. For babies this young, we have simethicone drops that are safe for gas relief.
Simethicone? Is that like the gas medicine adults take? I want to make sure it's safe.
It's specifically formulated for infants. It's one of the safest medications for babies because it isn't absorbed into the bloodstream.
How does it work if it's not absorbed? That doesn't make sense to me.
It works by breaking up gas bubbles in the stomach, making them easier to pass. It stays in the digestive tract.
And I can give this to a 5-week-old? My wife will kill me if I give the baby something dangerous.
Completely safe from birth onward. The dosage is based on weight. How much does your daughter weigh?
She was 8 pounds at her last checkup 2 weeks ago, so probably around 9 pounds now.
Perfect. You'll give 0.3 milliliters up to 12 times a day as needed. I'll show you how to use the dropper.
12 times a day? That seems like a lot. Should I be worried if I need to give it that often?
That's just the maximum safe amount. Most babies only need it a few times daily. Use it when she seems uncomfortable.
What if this doesn't work? How long should I try it before calling the doctor?
Give it a day or two, but if she's running a fever, vomiting, or you see blood in her stool, call immediately.
Blood in the stool? Now I'm really panicking. Should I be checking every diaper?
Don't panic, I'm just covering all bases. Those symptoms are rare but important to watch for.
Is there anything else I can do besides the drops? My wife is exhausted from the crying too.
Try the 5 S's: swaddling her, side position, shushing, swinging, and sucking. These often calm colicky babies.
The 5 S's? Can you explain those? I want to try everything.
Swaddle her snugly, hold her on her side or stomach across your forearm, make a loud shushing sound, gently swing or rock, and offer a pacifier. That's so specific. Does this actually work, or is it just old wives' tales?
It's based on mimicking the womb environment. Many parents swear by it. Combined with the drops, you should see improvement.
Thank you so much. You've made me feel so much better about this. First-time parent nerves.
You're doing great. All new parents go through this. Call us anytime if you have more questions.
I need something stronger for my migraines. The over-the-counter stuff stopped working months ago.
I'm sorry you're suffering. How often are you getting these migraines, and what have you tried so far?
At least 3 or 4 times a week. I've tried every pain reliever in this pharmacy. Nothing touches them anymore.
3 to 4 times weekly is concerning. That frequency suggests you might be experiencing rebound headaches.
Rebound headaches? What does that even mean? I just want my head to stop pounding.
When you use pain relievers too frequently, they can actually cause more headaches. It's a vicious cycle.
So you're telling me the medicine I'm taking for headaches is giving me headaches? That's ridiculous.
I know it sounds counterintuitive, but it's very common. How many pain relievers are you taking per week?
I don't know exactly. Maybe 2 or 3 pills every day. Sometimes more when it's really bad.
That's definitely too much. Using pain relievers more than 2 or 3 days per week can trigger rebound headaches.
So what am I supposed to do? Just suffer through the pain? That's not a solution.
Not at all, but you need to see a headache specialist. There are preventative medications that can reduce migraine frequency.
Preventative medications? You mean I'd have to take pills every day even when I don't have a headache?
Exactly. They work by preventing migraines from starting rather than treating them after they begin.
What kind of medications are we talking about? Are they strong? Do they have bad side effects?
Several options exist: beta blockers, anti-seizure medications, antidepressants, or newer migraine-specific drugs. A specialist can determine what's best.
This sounds complicated and expensive. Can't you just sell me something stronger without a prescription?
I legally cannot, and honestly, that would make your situation worse. You need proper medical management.
Have you ever had migraines? Because it feels like you don't understand how desperate I am.
I understand completely, and that's exactly why I'm urging you to see a specialist. You deserve real relief, not temporary patches.
What if I can't get an appointment quickly? What should I do for the migraines in the meantime?
Try limiting pain relievers to twice weekly maximum. Use ice packs, dark rooms, and caffeine in moderation. Keep a headache diary.
Headache diary? How is writing about my pain going to help?
It helps identify triggers: foods, stress, sleep patterns, hormones. The specialist will want to see this information too.
Fine, I'll make an appointment, but if they can't see me for months, I'm coming back here.
Fair enough. Meanwhile, I'll give you some magnesium supplements. Studies show they can help prevent migraines naturally.
Magnesium? Really? I'm willing to try anything at this point. How much should I take?
400 milligrams daily. It takes a few weeks to work, but many migraine sufferers find it helpful. Start tonight.
Hi. I need something for acne. My face has been really bad lately, and nothing seems to help.
I'm glad you came in. Let's figure out what's going on. What products have you tried so far?
Just regular face wash from the grocery store. And my mom bought me some cream, but I don't think it's working.
What kind of cream? Was it for acne specifically or just general skincare?
I'm not sure. It's just some moisturizer she had. She said keeping my face clean would fix everything.
Well, she's partially right. Cleansing is important, but acne usually needs targeted treatment. Can you describe your acne?
It's mostly on my forehead and chin. Lots of red bumps and some really big pimples that hurt.
Those painful ones are probably cystic acne. How often are you washing your face?
Like 5 or 6 times a day? I wash it whenever it feels oily. Is that bad?
That's actually too much. Overwashing strips your skin's natural oils, making it produce even more oil to compensate.
Wait, seriously? I thought washing more would help. No wonder it's getting worse.
Twice daily is plenty, morning and night. You need a proper acne-fighting cleanser with salicylic acid or benzoyl peroxide.
What's the difference between those two? Which one should I get?
Salicylic acid unclogs pores and is gentler. Benzoyl peroxide kills bacteria but can be drying. Let's start with salicylic acid.
Okay, is that all I need, or should I use other stuff too?
You'll also need an oil-free moisturizer. I know it seems backward, but even oily skin needs hydration.
My skin is already oily. Why would I add more moisture? That doesn't make any sense.
When skin is dehydrated, it overproduces oil trying to compensate. The right moisturizer actually helps control oil production.
This is so confusing. Should I also use those acne spot treatments I see in commercials?
You can use benzoyl peroxide spot treatment on individual pimples. Apply it after cleansing, but before moisturizing.
How long until I see results? I have school pictures in 2 weeks.
Honestly, skincare takes time. You'll see some improvement in a few weeks, but real change takes 6 to 8 weeks.
That's so long. Isn't there anything faster? What about those pimple patches?
Pimple patches work great for active breakouts. They protect the pimple and help it heal faster. Wear them overnight.
Should I be doing anything else? Changing my diet or something?
Diet can play a role. Try reducing dairy and high sugar foods. Also, change your pillowcase frequently and don't touch your face.
I touch my face all the time without realizing. That's probably making it worse, right?
Definitely. Your hands carry bacteria and oil. It's a hard habit to break, but it makes a big difference.
What if all this stuff doesn't work? Should I just accept having bad skin forever?
Absolutely not. If over-the-counter products don't work after a few months, see a dermatologist. They have prescription options.
Thanks for not making me feel stupid about this. Everyone acts like acne's no big deal, but it really bothers me.
It's not stupid at all. Acne affects confidence. Stick with this routine and be patient. You've got this. I desperately need sleeping pills. I haven't had a decent night's sleep in weeks, and I'm falling apart.
I hear the exhaustion in your voice. Before we talk about sleep aids, tell me what's been happening with your sleep.
I lie awake until 2 or 3 in the morning, and then my alarm goes off at 6. I'm running on fumes.
That's brutal. What happens when you're lying there? Is your mind racing or do you just feel awake?
My mind won't shut off. I'm thinking about work, my to-do list, everything I didn't finish that day. It's exhausting.
That's anxiety-driven insomnia. Sleep medications won't fix the root cause. We need to address your stress and sleep hygiene.
Sleep hygiene? I shower before bed. What does hygiene have to do with sleeping?
Sleep hygiene refers to habits that promote good sleep, routine, environment, pre-bed activities. Let's start there before medication.
I don't have time for complicated routines. I need something that works tonight. Can't you just give me Ambien?
Ambien requires a prescription and comes with risks: dependence, next-day drowsiness, even sleepwalking. Let's try safer options first.
Fine, but I'm skeptical. What could possibly help if real sleeping pills won't?
First, melatonin. It's a natural hormone that regulates sleep-wake cycles. It's not a knockout drug, but it helps reset your rhythm.
I've heard of melatonin. My coworker takes it. How much should I take and when?
Start with 3 milligrams, taken 30 to 60 minutes before your desired bedtime. Not when you want to fall asleep, when you want to start winding down.
What's the difference? If I want to sleep at 11, why wouldn't I take it at 11?
Melatonin signals your body to start the sleep process. It needs time to work. Taking it at 11 means you'll feel sleepy around midnight.
Okay, that makes sense. What else can help? Because honestly, I'm desperate.
What's your evening routine? Are you on your phone or computer before bed?
I usually work on my laptop in bed until I'm too tired to continue, sometimes until midnight or later.
That's sabotaging your sleep. Blue light from screens suppresses melatonin production and stimulates your brain.
But I have to finish my work. I can't just leave things undone. My job is demanding.
Your body needs recovery time. Consider setting a firm work cutoff time, say 9 p.m., and no screens after 10.
That sounds impossible. What am I supposed to do instead? Just sit in the dark?
Read a physical book, take a warm bath, do gentle stretching, listen to calming music. Train your brain that bed equals sleep.
What about those sleepy time teas? Do they actually work, or is that just marketing?
Teas with chamomile, valerian root, or passion flower can help. They're mild but effective for many people.
Should I take the tea and the melatonin together, or is that too much?
You can combine them. Have the tea around 9, melatonin at 10, screens off by 10:30, lights out by 11.
This is a lot of changes. What if I try all this and I'm still awake at 2 a.m.?
If nothing improves after 2 weeks, we can try antihistamine-based sleep aids like diphenhydramine, but give these changes a real chance first.
All right, I'll try it your way. But I'm coming back in 2 weeks if I'm still exhausted.
Deal. Keep a sleep log so we can see what's working. Your body will thank you for prioritizing rest.
My son just got stung by a bee and his arm is swelling up. I need an EpiPen right now.
Stay calm. Is he having trouble breathing? Is the swelling spreading beyond the sting site?
His arm is really puffy and red, but he's breathing okay. Should I be rushing him to the emergency room?
Let's assess the situation. Is the swelling just around the sting area, or is it spreading to his face, throat, or other body parts?
Just his arm so far. It's about the size of a baseball around where he got stung. Is that normal?
That's a large local reaction, which is different from anaphylaxis. Is he wheezing, having difficulty swallowing, or feeling dizzy?
No, none of that. He's crying because it hurts, but he seems okay otherwise. So this isn't an emergency.
It's not anaphylaxis, which is good news, but we need to treat the reaction. Unfortunately, EpiPens require a prescription and are for severe allergic reactions.
Then what should I do? I can't just let his arm stay swollen like this.
Give him an antihistamine immediately, diphenhydramine or cetirizine. That will reduce the swelling and itching.
How much should I give him? He's 8 years old and weighs about 60 pounds.
For diphenhydramine, give him 25 milligrams. For cetirizine, 10 milligrams. Both are safe for his age and weight.
Which one works faster? I want to help him as quickly as possible.
Diphenhydramine works faster but causes drowsiness. Cetirizine takes longer but won't make him sleepy.
He's already upset and it's the middle of the day, so I'll go with the non-drowsy one. What else should I do?
Apply a cold compress to the sting site, elevate his arm, and you can give him ibuprofen for pain and additional anti-inflammatory effect.
Should I try to remove the stinger? I've heard you're supposed to scrape it out, not pull it.
Correct. If the stinger is still there, scrape it out with something flat like a credit card. Don't squeeze or use tweezers.
Why not tweezers? That seems like the easiest way to remove it.
Squeezing with tweezers can inject more venom into the skin. Scraping removes it without releasing additional venom.
Got it. How long will it take for the swelling to go down?
With antihistamine treatment, you should see improvement within a few hours. The swelling might take a day or two to completely resolve.
What if it gets worse instead of better? When should I actually take him to the doctor?
If the swelling spreads rapidly, if he develops hives all over his body, or if he has any breathing difficulty, go to the ER immediately.
This is scary. Should I get him tested for bee sting allergies?
That's a good idea. Talk to your pediatrician about allergy testing, especially since this was a significant local reaction.
If he is allergic, would he need an EpiPen for future stings?
Possibly. If testing shows a true allergy, your doctor would prescribe an EpiPen and teach you both how to use it.
Thank you for helping me stay calm. I was imagining the worst when I saw his arm.
That's what parents do. Get him the antihistamine and keep monitoring him. He's going to be just fine.
I'm grabbing the medicine now. Should I keep antihistamines on hand from now on?
Absolutely. Every family should have antihistamines in their medicine cabinet. They're useful for so many situations beyond bee stings.